Our next speaker is my boss, so I suppose I better say a few kind words about him, really, especially as my appraisal's coming up in the not too distant future. Mike is a main board director for the Trust and holds the post of Director of Strategy, which in fact was the post of which Fiona held prior to her departure up to Great Ormond Street. Mike's a relative newcomer to the Trust, not as new as me, but he joined us in 2010, and he brought with him really a wealth of commercial experience from a variety of industry sectors, which no doubt he'll tell you a little more about. Mike, over to you.
I think one of the things that I'd like to point out really at the outset is I'm not going to give you a presentation around the strategy of the Trust, because I think that's available on the website, and I think that from your point of view, you can pick a lot of that stuff up. Actually, what you're probably more interested in is actually, well, why are these kind of relationships important to us? And I think Fiona's given you a really good sense of where the Trust is at the moment, and also a flavour of where it wants to go. She talked a lot about the sense of scale, and I think without going through all of this detail, one of the things that I was reflecting on last night when I was thinking about the scale was, yes, this is like a small town, this place. It covers off a whole range of different interests, but actually it's constantly alive. So we have 1,000 beds here, and there are many cases, many different days in the year when actually all those beds are full. So what I want to give you a sense of is the fact that for all sorts of different reasons, this place is very vibrant. The opportunities that are there exist not just within a 9-to-5 environment. When you think about technology, for example, we need different types of technology between the day and the night. And so therefore there's all sorts of different things that we can explore. The 9,000 staff, I think, one of the points to make about that, of course they're not all on site at the same time, but actually when you do look at that main retail area that we have, that reception area, we did a survey about a year ago, and we measured the footfall in and out. 7,000 different journeys in and out of that main door on one day. 7,000 journeys. That's not 7,000 people, admittedly. Some people go in and then come straight back out again. But actually, that's just through that one door. So you're looking at probably about 3,000 to 4,000 people, staff, patients, visitors. That's not the only entrance to the site. So we have a range of people who are coming in at all different parts of the Trust. And again, I mean, the joke around car parking for whenever it's kind of mentioned is the fact that I'm responsible for it. So actually for me it's very important that we get that kind of stuff right. And technology, for example, can help us with that. So really, I suppose the main thrust of my presentation is why is commercial activity important to us? As I say, Fiona painted a picture of the overall sort of focus of the Trust, where we're moving, some of our success. But actually there is a commercial reality that exists. I don't know if anyone was listening to the radio this morning, Radio 5 I woke up to. Our first news story was around the mid-staffs review, and around the fact that there are, I think it was 20,000 nurse vacancies within the UK. And the question being asked by the journalist was, well actually, you know, why are there so many vacancies? Is this because, you know, trusts are holding these vacancies to save money? The harsh reality is we live in a cost-constrained environment. Costs are being cut all the time, and all of the innovation that Fiona talked about has to be paid for out of the tariffs that we currently receive. Now those tariffs, so we get paid a certain amount for all the activity that we do, those tariffs, 40% of them will change by plus or minus 10% within a 12-month period. So it becomes really difficult to plan the financial stability of the Trust. And when you think that this organisation runs pretty much like a mutual, so we're not here to make significant profit, the surplus that we generate is quite minuscule. You're talking about sort of 1%. So actually, if those tariff changes happen quite significantly, then you find that the surplus that you're generating can be reduced very quickly. And of course that means that you can't invest going forward. I put this point up about profit will be hard to sustain, or surplus will be hard to sustain, for the simple reason that the NHS works pretty much on an open book basis with its commissioners. So commissioners are told you can only spend so much money. we have to be very open about the amount of activity that we're doing, the amount of money that they're going to be charged. If they see a trust that is generating a huge amount of surplus, then actually they're not going to want to be giving them all that money. So it's not an environment that works to create surpluses for trusts like ours. And again, that means it's really difficult for us to generate the sort of surplus that we need to invest in the innovation and services that we provide. Changes in prevalence of certain conditions, so drug costs I think are currently going up at 7% per year. If you get a sudden increase in the prevalence of a certain type of cancer, again, that can have a significant impact on your ability to generate a surplus. And also competition, patient choice, patient needs, all these things, patient needs in particular. So gone are the days now where you would, I always kind of think of when I joined the NHS, which was only 4 years ago, I always kind of think of things like Only When I Laugh and Carry On Doctor and all that sort of stuff. And, you know, this view that actually people come into a trust for an operation, they'll stay there for quite a long time and they'll get to meet the people in the beds next to them and all that sort of thing. People don't want that anymore. They want to come in and they want to leave very quickly. But they want, in that period of time, a high level of care, and they want to make sure that actually when they leave the trust that they don't have to come back again. And that's why we link in with things like healthcare at home and that sort of thing. We link very closely with GPs. So I suppose the point I'm making is that there is a commercial reality that the trust faces, that we need to have money to invest in services. We need to generate innovation and new ideas, but actually that's a really difficult thing to do. So where do you make the money to actually do all these things that you have to do? And that's why we have a commercial strategy, because we need to actually look into actually who can we work with to generate new innovation? Who can we work with to help us fund the redevelopment of the front of site, and because that is really important. And I think ultimately, I put this point to continually strive to provide a better service for those people who really count. That's why we're doing the commercial activity that we do. It's all for patients. All of the conversations that you hear when you talk to Melita, hopefully at a later date, all of the stuff that we're talking about doing here in the Trust, it's all about generating surplus so that we can invest it back in the care that is really important for people. I wanted to use this slide as a bit of a metaphor, really. So what this shows is admissions into this trust over 2 periods of time, 93 to 97 and 2008 to 2012. And I mean, the point about this is that actually you can see the darker areas are where people are coming from. In fact, even this green shows people are travelling from way up north. I talked about customer needs, patient choice, or rather patient needs and patient choice. But actually people are starting to vote with their feet now. People are starting to say they're going online, they're looking at outcomes from different trusts, and for certain services they're saying, actually, I want to go to the place that provides the right sort of service. I want to go to the place that is going to get me right the quickest. And that creates a huge opportunity both for us and for also the partners that we work with. But the reason why I say it's a metaphor is because this growth that we've achieved is not being done through some kind of aggressive takeover activity. It's not about us forcing our way into new markets and that sort of thing. But it's actually all through collaboration and excellence in service. And the more we do that, the more innovation we can do, the better the service we can provide, the greater the opportunity for ourselves and our partners. This is an example. I'm not going to go through this in detail. I'm kind of conscious of time, but actually it's not even an example from this trust. It's a number of clinicians who were working in Salisbury who developed an electronic device that was designed to help people with spinal injuries and that sort of thing, help them get over strokes, help them to walk properly. The point around this is actually they needed some help to create this device. The treatment was very successful, and as a result they formed a company with the trust, spun it out, and they're now providing this product on an international basis. They wouldn't have been able to do that if they didn't have partners that they were working with, if there wasn't some form of innovation. And that sort of, in order to make that happen, I know you're going to get a presentation from Martin Stevens later on, so around the AHSM, but in order to make that happen, it's a case of you need the clinical expertise, but then you need a whole range of other different types of expertise, some of it commercial, some of it technical, There's a group of people who have to be pulled together to make it all happen. But if you can do that, then the opportunity is significant. Fiona's talked about the people here, and I think I'm very proud to work in this trust. I put a number of things up here around the kind of achievements that we've got. The purpose for doing this was actually to give you a sense of it isn't just about people with a particular area of expertise focusing on delivering that and making it better. It's about people having a general interest in everything that they do. So operational management, we work in an environment where we've got a 5% growth in activity every single year, which we absorb. And that's 5% across the board. So there are certain specialties where you're talking about double-digit growth. The financial management required to achieve that is quite considerable. And we have the CIP programme is our cost improvement programme, so it's a cost-saving programme that we run every year. And actually we're sort of keeping up pretty much with the level of change in terms of demand. So we're saving money in order to provide more service. But again, we need to be creating more money in order for us to invest. And the only other thing I really wanted to point out on this slide was around the brand, because I think my background, as Mel said, is more commercial. I've worked in retail, financial services, utilities. For me, the power of a brand for a large company, for a small company, is really important. And actually, if you've got a small brand, but you can piggyback on the back of a much larger brand, then actually it makes an awful lot of sense. And I don't know how many of you watched the opening ceremony of the Olympics the year before last. I was going to say last year. But actually, that piece around the NHS and that brand being exposed internationally, well, we're part of that. But then we also have our own brand, UHS, linked with the university, that is growing regionally, nationally and internationally. So it's something that's very powerful to be a part of. I think my last slide really is to just point out, again, Fiona talked about this development. I was just going to give a bit more insight into it. So at the moment, we're looking to redevelop the front of house. We're looking to redevelop car parking because actually, I think you all arrived relatively early, so hopefully you got into the car park okay. If you'd have left it an hour, you'd probably still be waiting there. But I'm not proud of that. I really want to change that. But I can't, to build a multi-storey car park is quite an expensive thing to do. So you have to have partners. And that's what this is all about. This is a particularly large development. The Children's Hospital is another large development. This is a very ambitious organisation. We're prepared to take things on and push them forward and deliver them and develop them very quickly. But actually that same sort of desire works for smaller projects as well. Because even something small like an app for doctors or that sort of thing, for fertility trials, those sorts of things are things that we're looking at all the time as well. So large or small, the enthusiasm, the energy is there. And we're looking for partners to support our ambitious plans. So I'm grateful for the fact that you're all here, and I'll finish on that.